In 2012, the WFH president published a call to action for organizations to support the global inherited bleeding disorders community through treatment product and financial donations. In 2014, Biogen and Sobi responded to this call. They pledged an unprecedented 1 billion IUs of factor concentrates to the WFH Humanitarian Aid Program. This bold commitment opened the door for other donors and partners to step in and join the program. Now, 10 years later, we can see the incredible impact this donation has had on the effectiveness of the program and, by extension, the quality of life of thousands of people with bleeding disorders around the world. Access to treatment is crucial for those living with bleeding disorders around the world, and while treatment products for managing emergency acute bleeds is of critical importance, a predictable supply of donations is needed to truly enhance the quality of life of people with bleeding disorders. Thanks to the donations made, the WFH Humanitarian Aid Program has been able to provide a consistent and predictable supply of treatment product to those who need it most around the world. As a result, many lives have been saved and changed for the better. To date, 1.95 billion IUs of treatment product have been donated. 26,000 patients have received treatment, and 400,000 acute bleeds have been treated. Where once people died because of a lack of factor, now prophylaxis is a reality for thousands of people around the world, most of them children.
Sin profilaxis para él, pues, no es posible tener una vida. Así era nuestra vida.
Pues la donación de factor para los niños ha sido la mayor bendición que hemos tenido en el país y la mayor bendición para todas las familias que gozamos de profilaxis, porque nos devolvió la sonrisa, nos devolvió la vida.
As donations became more dependable and consistent, the program started training healthcare providers on the efficient and effective use of treatment products. Soon, education initiatives were launched geared towards providing people with bleeding disorders with the best possible quality of life.
Thanks to humanitarian aid, we now have clotting factors, and because of several workshops, seminars, publications, physicians and other healthcare workers are more interested in hemophilia care and are willing to contribute.
Thank you so much for the humanitarian aids for providing life-saving factor to us.
By providing support to communities, the program has also helped national member organizations. Using data from their own communities, national member organization leaders can show government the impact consistent access of treatment can have on people, greatly helping their advocacy efforts.
As time has gone by, we have now developed a different aspect of management of this patient. So we walk the path with the patient.
Thanks to the WFH Humanitarian Aid Program, people with bleeding disorders are now able to receive corrective surgeries in addition to life-saving and limb-saving surgeries.
We've been able to do almost 150 to 200 surgeries of different intensity.
With WFH factor, we have done more than 100 dental procedures in the last 2 to 3 years.
So yeah, the factor has changed lives. The humanitarian aid has hugely made a difference to us.
They can attend school and play with their peers. Their parents miss less work, can plan for the future, and have the peace of mind knowing that should an emergency arise, their child will get the support they need.
I have seen patients growing up to be lawyers and serving and coming back actually to the association to be able to support in advocating for better care.
In the past, a hemophilia diagnosis was a death sentence for the majority of people around the world. Now, there are many resources available for families, doctors, community members, and people with bleeding disorders. This is all thanks to the generosity of the sponsors of the WFH Humanitarian Aid Program.
Mine is a big thank you, World Federation of Hemophilia, for taking us this far and walking with us the path.
This program actually means the difference between life and death.